Okay. Hi, everyone. I am Dr. Shantae, and I am coming back with another video. And this is to ask for mass support for something that is very, very near and dear to my heart, the profession of naprapathy. Many of you who know my background and may know me from years ago, you know that I first started my in the medical discipline of pharmacy. And for me to be involved in a profession that may be seemingly on the opposite side of the spectrum, it's like, oh my God, what is this medicine? Naprapathic medicine. Oh my goodness, there's so many things to say about it. And right here on the screen, I have a fact sheet for everybody so that you can get a quick synopsis of what Naprapathic medicine is and the doctors of naprapathy and where to find us. I do want to share with you guys naprapath.org. You know what I'll do? I can actually pull this website up for you. That way, you guys know where to find us. And naprapath.org is the official website for the American Naprapathic Association. I am here to talk to you about what you see on the screen here. And this is the Naprapaths, or DN, fact sheet. So for the naprapaths watching this video, you should have received this both in an image and a PDF format so that either you can circulate and share the image by text message, or maybe you're emailing the PDF document to people. So what is it that I am asking you all to do? Well, I'm asking you to do the thing that I am seeking to do. What I am going to do first is switch around really quick to share my screen. Here we go. I should have a new share popping up. So now I've gone to the Board of Elections to see who are my representatives and senators. So I can see that from here. And this is just the Board of Elections website for the General Assembly. All you have to do is put your address in, and it's going to show you the people who represent you in the districts where you live. So now I can see in the district where I live who I'm going to be sending this fact sheet to. We have websites for them, phone numbers for them, addresses for these representatives, and they're going to get a fact sheet from them, from me as a resident of their district. Hi, I'm Dr. Shantae. I am a naprapath. I am practicing. I am seeking your support in the voting of our bill to renew my license as a healthcare provider in the state of Illinois. Okay, naprapaths, that is what we are saying to them, especially when you type in your address. Now, if you were to go to this website and you have a practice, for the naprapaths that have practices, the next thing that you're going to do is you are going to type in your practice address, because maybe that's not in the same neighborhood or even in the same township. You may have the opportunity to now reach out to two different people as far as when we're talking about the House or the Senate. And of course, there's more people than that, but two opportunities to reach out to a different set of people and still spread the word and share our fact sheet. So you're gonna, for the people where you type in your office address, your business address, for those people, what you want to do is say, hi, I'm a naprapathic doctor. I have a business in your district, and I would like to ask for your support to vote in favor for the bill that is going to renew my license in the state of Illinois. Because guess what? Your business as a licensed naprapath with a clinic in their district, you have employees, people that you are paying that's on salary, that's depending on your practice and your business for their livelihood. So it's affecting other people. It's not just about us. It's about the communities that we serve as well. And so you want to be able to articulate that to them so that we can look at the grand scheme here of things. that this isn't just affecting just these few licensed professionals, but it's affecting the lives that they touch as well. Rather, it's their patients or their employees. That is what you would like to do. So I will do this both for my residential address and for my business address. I am in another position where I preside over the college. So I am going to also put in the college's address and see who are those people that I need for the college's address. And then I will contact them on behalf of the college and community clinic that we have as well. Pretty much saying the same thing. And that may be a different set of people, depending, because in some cases, of course, when it comes to the senator, so just depending. So I'm just going to put those addresses in either way. And then I'm going to send that information to them, asking for their support to vote in favor of this bill so that this is something, a service, a healthcare service that we can continue to provide in the community that we have. And in the cases of the college, although this profession was founded in the 1900s, our founder of Naprapathy moved from Iowa to Chicago, Illinois. So one of the first colleges of naturopathic medicine started in the state of Illinois, city of Chicago. It started here. And when we first began to go for a license in the state of Illinois, history was made because we were one of the first licensed professions to have got unanimous support in both the House and the Senate. That's something we've been able to carry in our history for a very long time. And it's something that I would like to say that we're able to do again for 2023, because this is a valuable medicine, and any of the people who are our colleagues and patients would be able to attest to that as well. I became a napropath because I was very intrigued in the type of medicine that we're in. Originally, I came here for more nutritional studies. I just wanted to know more about nutrition. I was a practicing pharmacist at the time, dispensing medication, and I wanted to provide the people that I came into contact with additional options. What else can you do in addition to your medication therapy management? What else can you do? What options, what integrative options do you have? And that was just something that I wanted to do for myself until I developed a condition called frozen shoulder, which I was in excruciating pain. Now I'm a dispensing pharmacist at this time where I can't move my right shoulder. And pretty much it came from constantly having the phone from ear to shoulder, writing and locking in that position. I worked there in the pharmacy field there for nearly over 15 years. And maybe year 10 is when I developed that condition. Now, one of the things I didn't want to do is I didn't want to have surgery. I was very young at the time, and that's not to say that I'm old now, but I was young at the time and I didn't want to have surgery. I didn't want to take pain medications either, because I'm a pharmacist. I have access to narcotics. I don't want to take these things and in any way something happened to me where I become one of the statistics or people in the opioid use disorder category. That was my fear. So it was a blessing for me to have been in this school and just learning about nutrition. So happened I had a teacher who was teaching me in one of the nutrition classes. His name is Dr. Zahner. I'm sitting in my seat trying to take notes, but I am in excruciating pain and I am moving around in my seat. My face is scrunched up and he's very observant. And he said, Shantae, are you in pain? And I said, yes, yeah, my shoulder has been, I didn't even realize where I was, people. So I became the guinea pig at a class because some of the classmates that I had as well were also students in his technique class. And so I became the guinea pig at a class and we went to the back, they put me on the table and he did some things, and of course, I know what he was doing then, but I don't want to explain to you all what he was doing as a napropath. I want to explain to you what he was doing as a person who was standing there in pain that didn't even know what to do. And of course, when you're in a chronic pain, I mean, it changes your whole mental state, your mind state. You become depressed. You can't do the things that you used to do or enjoy yourself. My friend had a birthday party coming up, and I was like, oh my God, and I'm young now. And I'm thinking now I can't go. So now my life has been affected by pain. And I know a lot of you can relate to that, where you're not going places and doing things that you would normally do or would like to do because you're in pain. You've taken enough Aleve, you've taken enough Motrin, you've taken enough Tylenol with 3, but now you're just drowsy. Now you're just, you've taken enough Vicodin and you're just in the bed dazed, but you can still feel that pain. Diagnostic testing is telling you there is no pain, but you can feel it and you're like, no. And then other professionals are telling you, no, it's all in your head. I mean, I can just remember that. And to have someone touch and do something, move my shoulder in a way where I get up and I feel something different. I'm not in complete relief, but I felt something different. And I turned to him and I said, I will pay you cash if you can fix my shoulder. And I went to his office maybe a few days afterwards, and he went through the entire process, explained everything to me, treated me. And again, I'm explaining this to you as a person who is receiving the treatment, not as the practitioner, because I can get technical, but I don't want to lose people starting to talk all doctorly, right? So I've, needless to say, I mean, well, just all of that to say, I have never had a problem with my shoulder again. And that was just one treatment. It was enough to convince me to invest in the education of naprapathic medicine, where I went to school at night. I worked in the day and on weekends, and I went to school at night to become this, to be able to share it and provide this type of care, in addition to being a pharmacist as well, because that was just a personal path, a personal journey for me. But it has been such a blessing to my life, and it's brought me into leadership with the profession, being at the helm of naprapathic education now. And I'm just sharing my story. And I'm hoping, that you guys do the same, because you all have some very inspiring stories. I have heard some very inspiring stories from some of the naprapaths that became naprapaths because of injuries that they had themselves and no one else was able to help them. And so, again, the practice of naprapathy, we're connective tissue specialists. You have connective tissue throughout your entire body. And we specialize in that. We're able to evaluate and assess what's going on with you and provide treatment to you and some relief. It may not necessarily happen overnight in the case of what happened with my treatment. And it may have taken a couple of days because he put some kinesio tape on, because I remember I was feeling so much better. I went to a friend's birthday party. We went out, and people kept asking about my kinesio tape on my shoulder. Like, what is that? I was like, this doctor, this naprapath, put it on there, and it wasn't inhibitory. It allowed me to still do what I was going to do. I invested in this education and learned more. I learned more about my posture, which made it better for me to work because I stood on my feet for long hours as a dispensing pharmacist. And I was starting to have back pain from standing on my feet all of those hours. I learned what was the correct posture and how to equally distribute my weight at work. I learned how to sit in a seat properly. I learned how to sit in my car. I learned the importance of stretching and the balance that we need to have between resistive training and stretching. It needs to be a combination of both. I learned so much with nutrition, how to use it to reduce inflammation in the body, increase circulation, reduce pain, because that is what we do. In addition to assessing the spine, correcting the spine, getting the spine back into alignment, we affect all of the tissues of the body. And I can't tell you what a blessing this medicine has been to me, especially when I was pregnant and I knew some pain medications, you know, they were in some very dangerous pregnancy categories. I used to feel, my heart used to go out to the women who were pregnant that would come to the pharmacy counter and they're in pain, they have headaches, they have back pain, the things that are happening to their body inevitably because of their progressing pregnancy, right? My heart used to go to if they got sick. And I knew it was only so many things that they could take. That's what it's done for me. It's helped me and it's allowed me to give options to other people. And I'm fighting to keep this medicine here. I'm presiding over the American Naprapathic Association to bring this medicine to other states in this country where it is not in an official capacity, even though there are naprapaths that have left Illinois and they moved to other states to practice. But I want to bring it in an official capacity. And I want to connect to our partners internationally where naprapathic medicine is actually mainstream medicine. So I thank you guys for your time today. This is our website, naprapath.org, where you can learn more about us. You can learn about membership. You can learn how to find a naprapath. And this, of course, are for people who are active members inside of our associations. You'll find a way how the different state chapters and where you can find us as far as the schools. The National College of Naprapathic Medicine is on the north side of Chicago. You're going as far north as Belmont Avenue, but we're on the cross street of Milwaukee and Pulaski. That building has been there since 1965. We've been in a pillar in the community, treating the people of that community for a very long time. We have patients that still come here that have been coming here for nearly 30 years. So it's certainly an honor to be at the helm of naprapathic education and leadership and advocating for the DN bill of 2023. So remember, we're going to send these fact sheets. I'm going to switch back over to the fact sheet for you all. This is the fact sheet. We have State Representative Teresa Ma that is supporting that in the House, and we have Senator Emil Jones III that is supporting it in the Senate. You know, I was talking to one of the prior state reps that was a strong supporter for naprapathy a little earlier. And when I showed him this, he saw and he said, oh my God, his father lobbied with me in support of the original act. And I just smile. I'm like, oh my goodness, this is just fate. So I'm really excited about what's happening. It's been a learning process for me, definitely. So I thank you guys who have been in support to us. I thank everyone. So remember, we're sending these fact sheets and you're just going to go to the General Assembly, State Board of Elections. For those of you that have, I'll put the website links, I'll put the links to the website and also in our email, e-newsletter, I should say. And some of you have already received it, but for those of you who is not currently subscribed to our e-newsletter, and you would like to be able to find that link so that you could help us in the way that I have described in this video, I will make sure that I put it down in the description box. So let's see here. I've switched the screen so many times. Oh my goodness. Oh, I'll put it in the description box, but thank you guys so very much for your time. And we'll see you in the next video.